Hi, pregnant moms. This is Dr. Linda Burke-Galloway, author of The Smart Mother's Guide to a Better Pregnancy, blogger, and OBGYN physician. Today I want to talk briefly about home births. More and more women are opting to have their babies at home. Some people say it's a result of all the, quote, celebrity moms that are having their babies at home. Other people attribute it to the Ricki Lake phenomena with the documentary that she produced a couple of years ago. Whatever the reason is, mothers are having their babies at home. The numbers, I think, have increased by 20%. So let's talk about this for a minute from the perspective of safety. If you're going to have a baby at home, we need to go over certain things. Actually, I want to use a teachable case that will hopefully drive home the message about why safety is so important. Rebecca Fielding was a woman who went to a midwife and decided to have her baby at home. Unfortunately, the delivery did not go well. The baby got stuck, more than likely because it was either too big or there was a shoulder dystocia, and Miss Fielding ended up in the emergency room, transported by an ambulance. When she arrived at the emergency room, or actually probably the labor room, there was a 2-hour delay in terms of performing an emergency C-section. They were waiting for her blood type, and unfortunately it took 2 hours, and by the time the baby was delivered via C-section, it was brain damaged. A jury heard the case, and they opted to award the patient $55 million, which was a historical award. Legally, the patient can only receive $29 million, but Johns Hopkins says they beg to differ, that they in fact did give this patient quality care, and so they're appealing that decision. Now, let's hit pause and talk about this case for a minute. Number one, the midwife. Every midwife who does deliveries needs a backup obstetrician. Why? Not because they don't know what they're doing, but because they specifically are not trained to perform a C-section. And every delivery is not going to end up vaginally. Some babies will have to be born via C-section. So every midwife should have an OB backup. This particular midwife did not have an OB backup, and hence we begin the journey to an adverse outcome. So there was no OB backup. No one knew the patient's blood type. Had this been done, had the prenatal care been done in a traditional manner, there would have been a prenatal chart that would have been submitted to the hospital at 36 weeks. Now, even if you opt to deliver at home, anything can happen. A prenatal record needs to be at an institution, hopefully the institution that's closest to your home, so that if you have an emergency, they know exactly what your history is. Your chart is like your story. They need to know your story in order to know how to treat you. Third and lastly, let's see, I talked about the OB backup, I talked about the chart and the background of the midwife. This midwife had several lawsuits prior to this 2010 incident with Miss Fielding. I advise everyone, if you are going to have a midwife do your delivery, you need to, number one, meet her OB backup, and secondly, you need to go to the Board of Nursing and evaluate, look at her record. And this is not just singling out a midwife. I strongly encourage in my book that patients do the same thing for physicians, because things happen. Mistakes are made. Some mistakes are forgiving, some mistakes are unforgiving. And in this particular midwife's case, 5 complaints, and they were serious complaints, and I will blog about that on Wednesday. Those types of complaints would have been a red flag, and in truth, Miss Fielding should have never gone to this midwife. So, if you're going to have a home delivery, at least do it in a manner where you are going to try to have the best outcome, which means that you're going to think ahead and you're going to have an emergency plan. Until next time, this is Dr. Linda Burke-Galloway, as always, reminding moms, pregnant moms, that a healthy pregnancy doesn't just happen. It truly takes a smart mom who knows what to do. I invite you to check out my website, www.smartmothersguide.com, and pick up a copy of my book. You'll get a lot from it.